Feet and pelvic floor are a lot more related than you realize, and that's what this video is all about, to make you understand that your feet are your foundation and your pelvis is the foundation to your torso. So if your overall foundation, your contact point with the ground is not stable, then nothing above is going to be stable. While pelvic floor dysfunction and a lot of symptoms associated with it are being approached by going internally and working the muscles and, allowing you to kind of have a feeling of how to strengthen the muscles there. I want to bring to your attention the fact that you're breathing. When breathing in and breathing out will do relaxation and kegel if done right correctly. And it is a mechanics that's involved, but if you're not giving the body the structural strength it needs to properly breathe, then you will not have the automatic relaxation and strengthening of the pelvic floor. So how do we approach the feet? We've got to assess them from the very basic level. The very basic level is if you're sitting on a chair, to take your socks off. Can you see this in this video? Good. Place your feet on the ground. So imagine I'm sitting on a chair. It doesn't matter. I can sit on the floor, and for this video, I am doing it. You should be able to really press down on your toes and get these creases there. Are you able to do that? Look at the bottom of your feet. Do you have any callus formation? Calluses are formed where your point of contact is frequently met. And it should not be any calluses at the bottom of your feet. If you have calluses, it just shows that you're going on that portion of your feet more than others. So your gait, your walking needs to be assessed, and it's a very simple thing. All you have to do yourself, you could do this yourself, is record the way you're walking from behind, no socks, and pull up your pants so you can see the Achilles tendon where it's connected. Are you collapsing the arch? Are you going up high arching? Are you being more on the outside of your foot, inside of the foot? All of those can be looked at. And the answer to the correction is not always orthotics. While you can genetically born with flat feet, in which cases maybe wearing orthotics long term or is important, but that does not mean you just don't do exercises to strengthen it. Strengthen the leg muscles, which impact the arch. Bottom line here is we are so busy going to the muscles of the pelvic floor as if they're independent of the rest of your body. And here I am telling you that they only respond to what happens to the rest of your body as well. So strengthening them by themselves or stretching a tight muscle by itself is not going to take away the very factor or factors that are leading to those end results to begin with. I'm Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine. The focus of our practice is pelvic stability and looking at the biomechanics, the movement and stability and your posture behind pelvic floor dysfunction. If you are seeing your pelvic floor therapist, either a chiropractor, a physical therapist, an occupational therapist, a nurse, it doesn't matter. Your provider, your rehab clinician who has gone beyond and has gotten training for pelvic floor dysfunction, you want to make sure that you are receiving what it takes to have pelvic stability to begin with, because without it, all the work that you're doing is temporary if you think about it. Because if you don't have a structure that is stable enough to hold the work, it will not last. If you want to follow us on social media, make sure you visit the description box below. That's where you point of contact for my offices. And for those of you who are watching these videos and you are from other countries or other states other than California, We do provide coaching sessions, and all that information is in the description box. Look forward to providing more information to you. Until next time, take care.